Let's start off by just letting our viewers know a little bit more about your background and experiences.
Sure, and thank you again, Ty, for inviting me to be on, and thanks for everyone who has tuned in today. So I'll give you some fast background. My first real experience in the world was in the United States Army, and graduating from high school, I wanted to go to medical school, but I was really not prepared for college at that time, and the Army was a good opportunity for me to get some training, get away from home, which was one of the main concerns that I had at that time. And so I joined the Army Medical Corps, and I completed a course in anatomy and physiology and pre-hospital care at the Academy of Health Sciences in San Antonio, Texas. I served in the Army Medical Corps as a combat field medic. But because I excelled at anatomy and physiology and all the academics that the Army could send in my direction, I quickly found myself teaching at the 565 Medical Corps. And so that was kind of the early beginning of my training in healthcare and humanitarian types of ventures. But my interest really kind of shifted after the Army. And like a lot of people, I was interested in making money and working in business. And I had a number of different business ventures over the years. A lot of them that were failures, but I learned a lot from those failures. And then I had a few that were pretty big successes, and it makes all the failures worth the effort.
Yes.
For the last 12 years, which I think is going to be a big focus of our discussion today, I have been the chief executive or executive officer for Global Human Services, which is a non-governmental agency, non-governmental organization, an NGO that I started in 2008. We're going to come back to that, but that has been a particularly interesting period in my life, kind of changed the trajectory of my life. And more recently, over the last 5 years, I've run the free clinic in Canoga Park, where we deliver healthcare services to the poor. We also deliver food and clothing for community members who are in need. And that same 5-year period was the beginning of a ministry for me in the Church of God in Christ. And, this is really where I've kind of found myself, where I found my whole purpose and found some real meaning in life.
Oh, that sounds like an amazing journey. Thank you for your service. And
Thank you.
yeah, thank you. What really sparked your interest in healthcare and humanitarian work?
If it's okay, I made some notes because I think that this is important, and I wanted to make sure that I could cover some things that would be meaningful for you and for the viewers. So I'll be referring to these notes. So to your question, healthcare and humanitarian work, it was really the recession of 2008 that caused me to look at the world, look at my life and my career in a different way. And, I had to evaluate my priorities because ahead of the recession, my focus was really on making money. And that's kind of a selfish world to live in. The focus of that is to acquire all the assets that you can. And when I saw all of those assets leaving as a result of the recession, I just knew that there had to be something more meaningful that I could do with my life. And I had enough time to try and discover what that is. And I remember I was reading an article that came out of the United Nations. And the article talked about a pregnant woman in West Africa
Mm-hmm.
who was being transported by wheelbarrow in the 90-degree heat.
Oh my.
Uh, and they wanted to get her to a skilled facility so that she could have a safe, healthy delivery of her baby because she had had some complications. And the article ended um, by telling us that the woman and the child both died. And, you know, it struck me that the military training that I had might have been able to help this woman and might have been able to save her life. And um, so the first modular hospital unit was designed, and Global Human Services was formed. So I formed the NGO, and you know, the whole idea was that here is the real basic idea. Here is a woman on the side of a mountain in 90-degree heat who can't get to a place where they can deliver her baby. And so the idea was to bring the place to where she is.
Nice.
And the focus became looking at places that where the maternal infant mortality rates were the highest and where life expectancy was the lowest, and to bring the resources that were needed to those places. So it was really that article. It was, you know, I consider it was good fortune that there was a recession because it gave me time to reevaluate what my priorities were. And, you know, it was good fortune that I happened to be reading that article from the UN, and it just sparked an interest in humanitarian work for me.
Yeah, that 2008 recession. That's good that you were able to turn that into a positive. Although it like came with so many challenges, it's great that you turned it into such a great positive and motivation for you.
You know, so it's interesting how it worked for me. My focus shifted away from business and more toward how I could contribute to the world. And, you know, what I have to tell you is that it was that whole period was also the most successful period of my business career too.
Oh, nice.
But my focus was something else. And so, yeah, I was very, very fortunate that it worked that way. My priorities changed, and then I had the capital resources to put those to put to good use.
To shift our focus to COVID-19 and the global impact regarding that, how has COVID changed your international healthcare work?
So there are a number of different elements that we can look at. In a broad statement, the normal course of interventional global health has been interrupted, right? It's just been interrupted, and from every aspect of consideration. And so there are a couple of key elements that I just want to focus in on. Number one, so there are direct health consequences resulting from COVID-19, and they include physical medicine, of course. They also include social determinants of health, mental health issues, all of which are exacerbated by economic vulnerability. And I think that all of us who are working in global health and working in primary health care or in humanitarian ventures understand the underlying economics that drive our ability to deliver services to people who have no resources. We need money in order to make this kind of thing work. So when you start to talk about people who were living at or below the poverty line already, and now you isolate them, and if they are particularly living in a poor country that is aid dependent, then aid volatility becomes a significant factor because capital flows, money that was going into projects that were helping people. This is interesting. Helping people to live at or below the poverty line. Aid was helping people to live at or below the poverty line. No one was getting rich, but children were getting milk, and children were having the opportunity to go to school, and senior citizens were having the opportunity to get care for arthritis or to get care for hypertension and diabetes. And as a result of this aid volatility, because money doesn't flow into those international programs anymore, people are slowly returning to a poor standard of care that that existed for them before global health interventions had the opportunity to deliver any kind of aid or help at all. And so it's a sad set of circumstances. It's not just COVID-19 that we are talking about. We're talking about illnesses that people were living with prior to the global pandemic. So those are a couple of the the issues that we have to talk about and that we have to understand. But then also we have to talk about an increased incidence in anxiety and depression and despair and hopelessness that many people are now experiencing as a direct result of the social isolation that comes along with COVID-19, lockdown orders. And then there's just the fear that of what this disease brings. People are afraid. People are afraid. People who are working in global health from the academic health centers are afraid to travel to places. The universities can't support that work at this time. People have a lot of fear around COVID-19, and I'm among them. I mean, there are some good reasons to be afraid because we don't fully understand this disease and what its impact is going to be long-term on humanity.
Yeah, those are really big things and key things for us all to keep in mind, especially when trying to relate more and have more empathy to people that do not live in the United States. So yeah, those were really important points to bring up. So we have seen the impact of COVID-19 on the United States. How has the virus affected poorer and underserved countries? I know you mentioned it a little bit in the previous answer with people before COVID came,
right. Well,
aid just get like at or below the care, and now that's not able to happen. Is there anything else that you have seen that has really highlighted?
Well, Ty, there are a couple of elements that I think we ought to look at, and historically underserved, poor communities are disproportionately affected by catastrophic events. I mean, we know this to be the case. There's empirical evidence, and so now there is official development assistance (ODA) that flows to what are known as recipient countries. And ODA is important for many countries. It contributes to gross domestic product. It allows countries, poor countries, undeveloped countries, or developing countries, it allows them to build schools and to build hospitals. It provides for common welfare and common defense. And so this issue or this notion of aid volatility becomes a really, really important one when there is global uncertainty. And there is global uncertainty. What we are looking at right now is that we're uncertain about what the economic markets, financial markets will look like, what capital markets will look like. there have been global economic discussions that are pointing toward recession. And when we're looking at recession, you know, an issue is that we want to keep our money. We want to keep our money. And one of the things that immediately happens is the United States and all other countries. I mean, it's a no that other countries will withhold aid dollars until there is a time of some certainty. I want to just give you an example that I kind of thought through a little bit, and you know, will paint a picture, I think, for answering your question. So, with aid, with foreign aid from the U.S. Agency for International Development, for example, USAID, which contributes a considerable amount of money worldwide, but $75 billion in all of Africa on an annual basis, which is a considerable amount. But let's just look at smaller projects. Let's say $30 million that supports the Harvard PEPFAR program, that is delivering care and antiretrovirus medications to HIV/AIDS patients. And if you have a patient population of, say, 500 people who are receiving care and aid, and it is helping them to live longer, and we're being able to collect data as a result of this care. When those programs are interrupted, let's say, for example, a program that started in 2017, 3 years into the program, COVID-19 has caused a ripple.
Yeah.
And that ripple is very, very substantial, because it means that first, people who are managing those programs on the ground are recalled and have to return to their home countries. And so there's one on the ground to run the program. And second, it means that funding for those programs now is stalled. And that's the aid volatility, that's the cost of aid volatility.
So, why are people not willing to get tested, and why is there such a mistrust of our public health?
So there are a number of different reasons, and a lot of it is based on failed public health policy. A lot of it is based on failed public health experiments in our communities, really communities of color and communities where the larger percentage of people are ethnic minorities, you know, and rightfully so. We need to have a lot of concerns. One of those concerns is that we know that as much work is going into finding a vaccine for COVID-19, what we also know is that the information and the data changes on a daily basis.